I'm Jessica Johnson, and I will be volunteering for Myasia's videos and showing you different exercises that you guys can rehabilitate your injuries with. Let's go.
My client is performing a lateral raise using a TheraBand. As you can see, I'm cueing her on her posture, making sure she has a nice straight aligned back. There's no sagging in her hips, and she's not leaning too far forward when performing the movement. When dislocating your shoulder joint, the patient will experience some degree of pain, inflammation, and limited physical movement. When starting off this next movement, you can see that my client has improper posture, which can affect the workout and the efficiency of her range of motion. You want to make sure that your arms are to your side as you externally rotate your shoulder joint outwards, allowing resistance to help guide you and strengthen that joint. Rehabilitate a shoulder joint after it being dislocated is therapeutic exercises, which include stretching, strengthening, stabilization, in addition to aerobic conditioning, in which addresses impairment of range of motion.
The bands.
Each movement is slow and controlled, not fast and sloppy. This can affect the efficiency of your range of motion. As she comes up in the movement, she squeezes at that muscle, making sure that the shoulder joint and the muscles surrounding it are constantly under some sort of tension.
So in this area.
Now, when performing each movement, you want to make sure that you are aware of your breathing. As my client takes a step backwards, getting into her lunge, we want to make sure that her hips are not sagging. Her joint angle is at a good degree. Another exercise to assess balance would be stars. With her toes pointed, she is going to stretch her leg out as far as possible, going to the side, to the front of her, back to the side, behind her, and across her body, trying to maintain as much balance as possible. Another exercise you can do to help rehabilitate an ACL injury is a forward lunge, a stationary forward lunge. Right here, you can see that she gets far enough where she can feel a good stretch, but not a crazy amount of pain. Throughout these motions, I'm constantly asking her whether or not her pain level is high or if she's feeling comfortable throughout her movements, which is very important when assessing a client. In addition to that, you want to make sure that your client is breathing properly throughout each movement. Improper breathing patterns and techniques can also affect the efficiency of your movement and exercise. And also, you don't want to pass out in between each exercise. You want to make sure that you're healthy and you're performing each movement to the best of your ability. It's important to activate and engage your surrounding muscles, like the hips, the glutes, the calves. Right now, my client is activating her hips, releasing that tension and stretching and opening them up using the TheraBand or resistance band.
Put on the ball of your feet.
When walking your client through each movement or exercise that is going to help to get them back into shape and get them back into normal function, you want to make sure that you are reinforcing these forms of rehabilitation earlier on in order to have an effective treatment program and to prevent future or further injury for this athlete that's trying to get back to everyday performance. In addition to the exercises provided today, that are being performed by my client, you want to make sure that you rest your ankle for a good amount of time just to minimize the pain. You also want to make sure that you ice your ankle for 20 minutes on and off. This way we reduce inflammation and swelling. Another thing that you should do when you have sustained an ankle sprain is you want to make sure that you compress the injured area, which this could be done in the form of an ace bandage, any kind of wrapping or brace put on the ankle. And lastly, you want to elevate the ankle. This also helps reduce swelling and inflammation with the use and utilization of gravity. When performing these stretches, you want to stretch to a point where you feel minimal pain. Your pain is kind of what we base our exercises on. You want to know your pain threshold when performing each movement.